If you don't know me, I'm Suzanne Titkemeyer. I wrote for Pathos for nearly 10 years, a column called No Longer Quivering about the Christian quiverful movement. I now write for myself, do different projects throughout the U.S. and the world, and I do YouTube. So, the dark side of the Pura Vida, the medical industry. I have to talk about this today because I ran into it head on yesterday. I've run into it head on a few other times, and it can have bad consequences. The thing that everybody asks me about moving to Costa Rica is medical care. If you're a gringo here and you don't apply for residency, then your medical care is entirely paid for by you. Sorta. We go to private medical clinics ourselves. We have not finished filing to be residents. Our insurance covers us here. Most, I would say almost 100%, 100% for hospitals, and the usual amount for everything else. So we go to the private clinics, which are excellent, I have to say. If you're on CAHA, you're a resident here, you go to medical clinics, the government ones, and they're much like the ones we used to go to when my husband was with the military. They're like military clinics. You get really great basic care, but you may have to wait. And your drugs are free. Excuse me, I'm a little not quite well, so that's why I'm making this. Yesterday, I went to well, let me back up. If you're here on the economy, you're not a resident, you're buying your own health care, it is a lot less than it is in the States, thank God. If you have insurance, your stateside insurance may cover it, except for Medicare. Medicare covers nothing. Medicare does not work here. Neither does Medicaid. So if you have those as your options, you're going to have a problem. TRICARE with Champus usually does cover some things here. But here's the thing. Medical care here is so much cheaper. What I pay to go see the doctor is about what I would pay in the States for a copay. And that's my entire cost of my medical care, my doctor visit. And I just turn around and file it with my insurance company and get reimbursed at a pretty high rate. So there's that. So I'm paying a lot less for just basic care. I've talked about this before. The drugs I take, much cheaper here, cheaper even than copays. This is generic Lyrica that I take because I have nerve damage. I need this to sleep. And I'm paying about $25 to $50 a month, depending upon where I'm buying it from, before I even get reimbursed. So if you don't have health insurance in the U.S. and you're buying Lyrica, it could be $1,000 a month easily. So that's how much cheaper it is for everything here. But that's not say there are not drawbacks in the system, because there are a few. One of them for me is the asthma medication I was on. My nebulizer was called Zopanex. Zopanex does not exist here. It's just a reconfigured version of albuterol. So I'm on an albuterol type medicine. I'm on one called Combivent. So there are going to be some few drugs you're not going to be able to get here. But for the most part, you'll be able to get everything. The only real drawback I have run into here, besides that, is one that I ran into again last night. You go to the private clinic, you expect to be catered to, you expect the red carpet, you expect to be treated super great, and most of the time you are. I'm going to tell you. Awesome. How awesome? One time I had a TIA, a very minor little tiny little bitty of a stroke. The doctor came out to my house and watched me pack for a week hospital stay. That's the kind of one-on-one care you're getting here most of the time. Okay, for the last 6 days, I've had the most horrendous sore throat. If you know me well, you know I'm all swollen under here. I'm feverish. I'm not well. I'm coughing, the whole 9 yards. Yesterday, I finally went to the doctor because I had said, this isn't lifting. I need to be evaluated for COVID. Last week, I had 2 exposures to people with COVID, close exposures, both through church. And last Tuesday, a week ago yesterday, I'd had a COVID test that was negative. So I rolled in there with my history of my mast cell, with my history of my constant asthma and everything. And I pulled in the clinic and I saw Dr. O was on duty. I was excited because Dr. O is one of the doctors there. There's experience with me, and he knows with my asthma and my mast cell and various things what I do and what my drugs are and how much I take them. He knows that. But Dr. O was going off, and I got stuck with the earnest, well scrubbed, freshly minted doctor who does things by the book. And because it was after 5 when I went in there, and that's the nice thing about clinics here, the nice thing and the bad thing. 24 hours a day, 7 days a week, you can be seen. You can just walk right on in. You don't have to call and make an appointment like in the States. You just go on in and they treat you. And it's only like $5 or $10 more to be seen in the middle of the night than it is to be seen in the middle of the day. That is a huge advantage here. The disadvantage of going in the middle of the night is you get one of these younger doctors who's straight out of medical school, which can be a good and a bad thing. One of the doctors up there that's straight out of medical school, he is awesome. And I am always happy to see when he is working because he's on top of everything. He always asks me at the end of the visit, what are you still doing for your asthma? What's your mast cell plans? What's your asthma treatment plan? Because you have to have these things in place if you have the kind of crazy asthma I do. So he does what he's supposed to do. He goes over everything with you and goes to check, make sure that nothing has changed with your medications. I appreciate that. I appreciate thoroughness. Well, the gal I got last night looked at my throat. Well, first of all, I went in there and they asked me my symptoms. I told them. They said, okay, you have to go wait out in your car, and then we have to treat you in the back, in the very back. And I wasn't upset because that's what they do with suspected COVID patients. If you show up there, you have to wait in your car, and then they treat you in the very back of the building, away from everybody else, in this lone office attached to the radiology department. It is what it is, and I don't mind that because I was there to get a COVID test. That was one of the things that I was there specifically to get was a COVID test. I was armed with my health department number, saying that I'd already registered with the health department to have my COVID test, the whole 9 yards. So I get a little young doctor and she looks at my throat, she looks at my ears, she listens to my chest. She says, I should do a chest x-ray. I hear bubbling in the very bottom of your lungs. And I should do a blood test. But the radiologist and the phlebotomist are gone for the evening, and I don't feel like this is enough of an emergency to call them back in. So basically, she ended up telling me she was not going to test me for COVID. She was not going to call either one of them in to run the tests that were needed. And I know they're needed because every time I go back in there with Dr. O, Dr. A, some of the other more experienced doctors, with this kind of thing going on with my lungs, it's always a chest x-ray and it is always blood work, as well it should be. That's how it was at my pulmonology office too. So she didn't do either one of them. She said she wouldn't call either person back, even though they can come back in the middle of the night to do these things. They have in the past. And then she said, well, I don't think you're so sick. I think that you've got some kind of virus. You don't have anything bacterial. So she wrote me a prescription for cough syrup. Cough syrup. Okay, and coughing is something I'm only doing minimally, I told her. It was something I was barely doing at all. My symptoms are more disturbing. I have pain in my chest, pain in my lungs. I have a high fever. I have extreme sore throat, days and days and exposure. So she sent me home. But here's the comedy of her sending me home. One of the things she did was she told me, I want you to use 1 ampule of your CombiVent every 12 hours. And I just kind of laughed in her face. I was kind of like, which please, because the other doctors there know that there are times when I'm going to have to use three, count them, three vials of Combivent to get my lungs open. I try not to ever do that because that sends me in a really weird space, but it's not unusual for me to have to use two. And we're talking every 4 to 6 hours tops. So I just started falling off the table laughing when she told me to use one vial every 12 hours. Girlfriend, if I had to use one vial every 12 hours, I wouldn't even be visiting you. This would not be a thing. So this morning, I have booked a taxi to come at noon, and I'm going back in. And Dr. O is going to have a chest x ray and a blood test drawn because I called at 8 o'clock this morning and said, hey, this is not acceptable. And they said, well, she did do a rapid COVID test and you were negative. I said, I'm not even worried about that now. I'm not even worried about the COVID. I'm not worried about getting the PCR test like I was last night. What I'm worried about is the fluid that's clearly at the bottom of my lungs, complicating everything, and blood test to make sure there's nothing bacterial going on. For her to look down my throat and say there's nothing bacterial is not good enough. So that's the dark side of the pura vida of medical care here in Costa Rica. You're hearing it firsthand. 99.99% of the time, it's really the best care I've ever received, better than the States. But when it fails badly. And it's almost always when we have some young new doctor who goes by the book. And she was definitely going by the book last night. I still laugh. One vial every 12 hours? Oh my crocheter, please. That is not ever happening. I just have to laugh at that. And she kept asking me, you sure you can't take steroids? Girl, I am steroid intolerant like you would not even believe. It's in all of my records. Do not give steroids in big orange letters because I've had such severe reactions to them in the past. So even here in Costa Rica, you got to step up. You got to stand up for yourself. I was trying last night, but I could not persuade her to take me seriously. She just said I wasn't very sick. Yeah, there's a possibility I may not be very sick. But guess what? You're going to do the chest x-ray and you're going to have to do the blood work before you make that kind of a determination. So I'm off here very shortly to have all those things done. So now you know. Good most of the time, dropping the ball once in a great while, and she sure did. I'm going to avoid her when I go there from now on because clearly she's not the right doctor for me.